It's almost like love when you're listening to WMNF Tampa, St. Pete, and around the globe at 88.5 on your FM dial.
The opinions presented on the Healthy Steps show are the evidence-based opinions of Dr. Fred Harvey, the callers, and his guests. These are not the opinions of the staff, the volunteers, or the board of WMNF. The information provided on the show is not intended to diagnose or treat any disease. There is no implied patient-physician relationship in these calls. The nature of the calls is educational and informational only.
Hello there, my dear listeners, my friends and neighbors. It is so soothing to be back with you on this Monday morning. Words simply cannot express my thanks to you for keeping your radio tuned to WMNF Tampa, the only community-supported radio station that they stream in Yamatsu, Hirosaka, and you can stream us as well at WMNF.org. To my great joy, today is Ask Me Anything Monday. So you, yes you, my friend, you get to be the beacon that guides this show. If you have any medical questions or concerns for yourself or for a loved one, you just give us a call at 813-239-9663. Our superstar, Irene, has been sitting in the booth waiting for your call. So, just in case I rattle that number off before you got a chance to write it down, the number to call is 813-239-9663. And you can send an email to dj@wmnf.org or text us at 813-433-0885. Good morning to you, Dr. Harvey. Today is Ask Me Anything Monday, and there is no time to waste, so let me step back into the shadows and turn this show over to you. What have you got for us today, Dr. Fred?
Good morning, Bill, and thank you for that intro. It's a wonderful day in Florida. How's it going for you?
It's hunky-dory here. I'm really enjoying it. It's not too hot, and it's just a perfect kind of day.
Nice, I agree. And it's a perfect time, kind of day to talk about the sun. It's a sunny day, and we're going into summer. And so I thought that it might be a good idea to talk about melanoma, malignant melanoma. Yeah, that tumor is, it's not one of the most common skin cancers. Squamous cell, basal cell, they're the ones that people end up with most often. They're the most common, and they're the least of concern, the basal cell. The malignant melanoma is the one to be concerned about because it moves around the body so easily. And so, over the years, we've talked about how different cancers have different triggers, and melanoma seems to have a couple of different triggers. But the big one that people talk about, an avoidable one, is ultraviolet radiation. And we do know that a significant portion of melanomas do come from sunlight. Excessive sunlight, things that are associated with the incidence of more melanoma is painful bouts of sunburn. Getting sunburn to the point where you blister and peel. Another thing that helps to understand how much risk you have is your reaction of your untanned skin to sunlight. Does it turn golden or does it get bright pink? If you get bright pink, it's likely the injury that's going on in your skin is something that could cause some genetic mutation, DNA damage. This is how malignant melanoma occurs. There's a bunch of metabolism disruption that occurs in skin cells, and they turn into oxidative metabolism. I've talked about that before. That's when the cell is stressed and it's not able to keep up and it gets damaged. And also another thing that is an indicator is the number of moles on your body. But there have been people who don't do a lot of sunlight exposure and get melanoma. There are Australian lifeguards that get melanoma on the soles of their feet and in the anal cleft between their buttocks, where there's not much light shining. So you have to understand there are other reasons, but those are also controllable to some extent. No, we have genetic predisposition. If family members have had melanoma, if there's dysplastic nevus syndrome, these are people that have lots of moles that tend to be ugly and grow quickly and change in their nature. These people are susceptible to malignant melanoma. But there have been several studies that have suggested that there's a connection between the ultraviolet coming from fluorescent lights at work. And there was a suggestion that exposure to fluorescent lights could also be associated, and it looked like there might even be a fourfold relative risk, with 2 to 4-fold relative risk that would increase your risk of getting melanoma simply for being 10 years under fluorescent lights at work. So it may be a good idea to change to LEDs or other sources that don't have quite the intensity of ultraviolet. But toxicity also does it. We know that xenobiotics, chemicals that aren't natural but have an organic nature, things that are derived from petrochemicals, have a tendency to cause genetic mutation. There's even a suggestion that some of the sunscreens might do that, possibly titanium oxide, if enough of it is absorbed. I don't think you want to take it orally, but on the skin, it may or may not be associated, but it does reflect off the ultraviolet. The organic compounds like homocynomate and the benzene ring compounds that show up in many of these things are toxic petrocarbons that when they absorb the ultraviolet, they get turned into free radicals that can damage your skin and cause some changes in the function of your cells. And so that you have potentially miscommunication going on inside the cells that would be associated with some of these changes. And the incidence of melanoma has been going up globally, consistently. I don't think that we have a significant increase in sun exposure, though that may be there. There's no way to actually really check that. But there is increased aging of the population, and the longer we have exposures to chemicals and sunlight, the more likely we're going to get something to deteriorate. And these lay on the genetic causes. And so, and then there are random events where people just have a mutation that occurs that it could be sunlight, it could be, titanium, it could be lots of different things. But so the most of it is coming from ultraviolet. So why don't we think about easy ultraviolet protection? Don't go out in the sun if you can avoid it between the hours of 10 and 4. Stay out of peak sun. And if you're going to go out in the sun during those hours, wear a wide brim hat to protect your ears. Wear not just a ball cap to protect your face and the top of your head. Make sure it is a UV protective one. Those mesh hats don't do much protection for the top of the scalp. I know because I've got a terrible sunburn on my scalp from wearing a mesh hat one time. The outdoors clothing for fishing and for boating and other things that has been developed that's light and breathable and wicks your sweat away, but does 30 or 50 UV block on your body is a really brilliant thing to do, because then you're not applying chemicals to your skin that may actually provide further risk because of the carriers, which are petrochemical divide, because of the anti-UV, the blockers, which could be petrochemical or minerals like zinc or titanium. So the clothing is a brilliant way to go about it. Wear long pants when you're out. The golfer tan isn't necessarily good for the incidence of melanoma on your shins. And so, but you can also do some things that help to promote better cellular metabolism. So making sure that you avoid eating some of those xenobiotic chemicals. Don't eat processed food that has food additives. Don't eat processed food if you can avoid it. Ultra processed stuff. The stuff that's in the boxes in the middle of the grocery store. Process your own food. Buy some oats and blend them yourself into a powder so you can get a flour to make a pancake with, something like that. You know then that it's very clean. but you can also take things that support your system and may actually help you reduce the amount of cancers, especially melanoma, you're getting. Vitamin D bonds to its receptor and helps to change the way your cells metabolize. Vitamin D is anti-proliferative. It helps keep cancers from growing. Vitamin D is pro-apoptotic. Apoptosis is programmed cell death, so that it actually promotes sick cells, like cancer cells, to die for the benefit of the body. So vitamin D is a very good thing that we need, and we get it from the sun, but getting it from the sun also increases our risk of getting these cancers. So there's a delicate balance, and we might want to make sure that we take some vitamin D every day. 50 micrograms might be a good thing to do. So 2,000 international units is something that many people take. Other things that help, phytochemicals, eating your brassica vegetables that contain sulfur-containing organics that help your liver get rid of cancers and help turn on a system called NRF2, nuclear regulatory factor 2, helps cancer cells to go away and helps clean up cellular metabolism and turn it back into normal, healthy cells. If something's on the verge of becoming cancer, it might actually help clean it up. And so there's some really simple things we can do to keep down the risk of melanoma in Florida summer. And I think it's really worth it to apply just some simple stuff. Wear that broad brim hat. Stay out of the sun between 10 and 4. And on that, I'd like to remind people this is the Healthy Steps Show. We're on WMNF, the nation and the world's best radio station.
Yes, Doctor, and I do think that's pretty sage advice coming deep into the start of summer, and it's going to just get hotter and more burning. And I've got the, I guess not the curse, but I've got the Irish white skin that burns like just vampire-ish almost.
Yes, indeed. We Celts have a lot of that pink skin.
Indeed. Now, I've got Joe 1 and Joe 2, both from Tampa on the line, but I'm never satisfied with just a handful of people on the phone queue. I want to invite you to participate in the Healthy Steps radio show with Dr. Fred Harvey here on WMNF Tampa. And if you're just tuning on in, welcome. And you are encouraged to give us a call at 813-239-9663 or continue to send your emails to dj@wmnf.org. Let's go to Joe. Good morning, Joe.
Is that me?
Hello, Joe.
Joel, Joel.
Joel, how are you doing today?
Well, Doc, I got a situation I've been dealing with since Hurricane Milton.
Oh.
Blew the roof off my apartment, and the asbestos and drywall dropped on everything I own.
Oh, no.
So I feel that I have PTSD, and I'm investigating ways to help myself and recenter and rebalance my energy system. It's really quite strange for this 78-year-old teacher of wellness and holistic health care.
Yes, sir.
Doctor, have you heard of battlefield acupuncture, Richard Niemzow?
I have not heard of that, but I was thinking as you were talking that acupuncture is a good place to start with calming down the energy.
Well, I'm seeing a doctor of Oriental medicine, an acupuncture physician. I've seen him for 6 treatments, and I've gotten little benefit, and I'm concerned about my experience in the treatment.
Okay, yeah, I think that there are some likely more powerful interventions if you really do have PTSD. There's a lot of things that we've learned about it. So working on the triggers and using some psychotherapy, there's a system called cognitive behavioral therapy that helps you understand the trigger and help to step back from it when it's occurring. There's another thing, there are some really interesting programs available online. One of them is called the Gupta program, Gupta, and it helps to have you work through. It's like a cognitive behavioral approach, but you do it online, and it has consecutive modules where you learn to apply this information and work on stepping down the PTSD. You can also consider getting a medical cannabis card, because medical cannabis, when you use the CBD and or indica types of cannabis, it seems to step down some of that reactivity. I personally don't recommend any kind of benzodiazepine, Valium type medication, because they're addictive and they don't work very well for this problem. How do those things help, Joel?
I have a deep background in teaching and doing 923 radio shows, but I'm aware of triggers which alerted me to this disease challenge.
Yes.
I have gummies in the refrigerator. I have medical marijuana. I'll look at the Gupta program, but I'm going to pursue practitioners who understand the use of auricular therapy, ear needles. It's called battlefield acupuncture.
Yeah, that's worth considering. There's a point on the ear called Shanmen that actually calms significantly. However, I think that it's going to be limited. It will probably take you a year or so of continued acupuncture to get the system to move. I think there are more effective ways to do this more rapidly, including considering a ketamine clinic or psilocybin mushroom.
You know, a good friend of mine, a medical doctor, suggested psychedelics.
Yes, they're very effective.
And I don't, are they a quick fix or just a Band-Aid, or is it something that that could be thought of as a cure?
So there was a study done at the Johns Hopkins Psychedelic Research Center. And this wasn't, they did it with PTSD, but the most impressive one was with the chronic unresponsive depression, which actually people with long PTSD can get chronic depression too, because it's devastating. But what they found was that in the initial 5 visits, I think they did, they found 80% of people responded and no longer needed medication. When they looked at this same group of people 2 years later, 80% of the original 80% were still in remission. That means at 2 years, they had a 64% success rate. That's the best of any therapy on the planet for chronic recidivistic depression.
What again was that therapy used?
Psilocybin mushrooms.
Psilocybin. Well, this old medical doctor, a friend of mine, suggested that. I'll consider that.
I would consider it because it's going to take a long time with doing auricular acupuncture. Generally, the Oriental medical doctor will bring in the herbs because it takes so long to get the acupuncture to fix something this serious.
You know, and the present acupuncture physician I'm seeing has not recommended a single herb. I'm very curious about that. But I did learn from another old friend of mine who has moved away from the area. I just talked with him this morning, and he informed me of battlefield acupuncture, which has helped in as little as one treatment.
Yeah.
6 points in each ear, and after each point, you stand and walk around, and then answer questions, and then sit back down for the second point. So
well, I think it's worth a shot, Joel. You have a serious condition here, and it would be great for you to get some help.
I'm not living with it. I'm gonna correct this just as soon as I can. And thank you, Doc.
Good. You're very welcome. Have a great day and good success with that.
Thank you, Doc.
Mm-hmm.
Okay, let's go to Joe, who's been patiently waiting in Tampa. Good morning, Joe.
Good morning.
Hi, Joe.
Dr. Harvey. Hello?
Yeah, what you got for us today, Joe?
Okay, so I believe I have overactive bladder. I get up every hour to go, and I don't go much. And I was diagnosed with a moderate CPAP, so I'm using the CPAP, but I still get up. It doesn't help. And about 13 years ago, I had the TERP, the Roto-Rooter for the prostate.
Oh, so you have prostate hypertrophy too.
Which is what?
Overgrowth of the prostate.
So is it possible that the prostate has enlarged again?
Yes. Yes, it's likely that you had the prostate regrow after the TERP. It's been, what, you say 10 years?
No, 13. It's been
13.
a while.
Yeah. So it's quite possible that if you did not change your diet, your lifestyle, or any other things, and just had a surgery, the reason your prostate got too big was still there. You didn't change the reason it got there, and so it grew back again.
Okay.
So you need somebody to help you understand why the prostate gets too big. Extra saturated fat, lack of good antioxidants, lack of good lower body exercise, all kinds of things can contribute to your prostate overgrowing. And so you need a good coach to help you understand what to do after your next prostate surgery, because it sounds like you're heading directly for that.
Yes. So I do get plenty of exercise. I'm a mailman, and I get in and out of the truck every delivery.
All right.
I get in and out of the truck 150 times a day, so I get plenty of exercise.
Okay, so it's probably diet, lifestyle. There may be some hormone imbalances, so you probably want to get your hormones looked at. The urologist that did your TERP probably did not look at your hormones.
Okay. So
I would get somebody to help you with those issues and go back to a urologist and see if you need another surgery.
Yes. So I did get an appointment for a urologist in June 6th. But,
Very
I'm
good.
looking online, and there's this pill that Larry King endorses, the television host.
Yeah, isn't he deceased?
Yes. But he
Yes.
had a special program where he...
Let's not listen to Larry King anymore, because his information is 10 years old. He's been gone that long.
Oh.
Let's move into the future. And yeah, there are pills, but the symptom that you've got might be controlled by a pill, but it could be that your bladder outlet is obstructed and you're not peeing, and that's going to cause you kidney problems. So get it evaluated before you talk about therapy. Find out what's going on.
For sure, yeah. So I had blood work and all that. So, from the blood work, they'll be able to tell.
No, what they'll be able to tell is that you're healthy or not from the blood work. But what they need to do is probably a cystoscope, where they stick that scope into your penis and look into your bladder. They may want to do an ultrasound of your bladder. They may want to do something called a post-void residual, where you empty your bladder as best you can, and then they put a catheter in and drain it out and see how much fluid is left over to see if you have an obstruction there that doesn't let you completely empty your bladder, which it sounds like you do.
Well,
There's lots of tests.
I did have a CAT scan, and I did not empty my bladder completely,
There you go. Your prostate has regrown and you're having outlet obstruction, and you need to see the urologist to get this fixed, I think.
Yes, sir. Okay. Thank you, doctor. I appreciate your opinion.
You're really welcome. Go for it, man. Get better.
Yes. Believe me, I get up all night. I hate it.
That sucks, yes. You don't want to be doing that.
All right. Have a good day. God bless you.
You too. God bless you.
And best of luck to you, Joe. Let's go to Kay in Bradenton. Good morning, Kay.
Hi, Dr. Harvey.
Good morning.
Good morning. How are you?
Fabulous. How about you?
I'm good. I'm good for a Monday. I did a morning walk with my neighbor, and I'm doing good.
Excellent. I like that. Get your healthy steps in to start the week. Yay.
That's right. I know last Friday you talked about mammograms, and I've had breast cancer twice. The first time I had a lumpectomy, I was 44. The Moffitt bus showed up at my work, so I, have breast cancer in my history, my family history. So when I got the mammogram, it found a lump. So I, went through that process. And then in 2018, I got it in the same breast. So I had a double mastectomy. But I want to emphasize how important mammograms are for women. If they have family history of breast cancer, or if they can get to have a mammogram, it's very important, because if it weren't for mammograms, I don't know what I would have done. I probably wouldn't be here today.
I agree with you. They're an exceptionally good screening tool. But I think the best screening tool is a personal self-breast examination that many women don't do monthly, during different times of your cycle, if you're still actually cycling. And if you're not, pick a day and do it once a month. But you want to actually get to know your breasts so that if there is a change, you're the first person to know about it.
Right. I agree with that, but we don't. And you're right.
I know. So let's do it. I think that's the most important thing. Women, love on your bodies.
Yeah, definitely. And I know the lady said she had dense breast tissue, and they still found my cancer. So that's, that they can do it.
They can. And if you have really dense breasts, they can use ultrasounds and MRIs and other tools. With those other tools, you may not need to do a mammogram every year, especially if you're doing other things to look, like doing your monthly breast exam and doing a thermogram periodically in between your mammograms.
Right. Also, when women get checkups for the gynecology, they also do the breast exam. So
they do.
That's kind of like a backup. If you're not doing yours, they do that too.
No, I don't consider it a backup for you not doing yours. There's no such thing. You're actually responsible for your body, and you need to do it, period, end.
Yeah, you're right. Absolutely. All right, and I just want to say one more thing to Bill. I love your kind words.
Well,
thank you, my dear.
Yeah, thank you very much, Kay. I appreciate hearing that. And I mean them, too.
Okay, I'm sure you do. You sound like you do. Well, have a great day.
You as well.
Thank you. You have a great week, my dear.
Bye-bye.
Bye-bye.
And thank you very much for that, Kay. I've got Jennifer. Indeed. Go ahead.
Oh, yes, indeed. Bill, you always have a kind word, and thank you. I really enjoy sharing this spot with you.
My pleasure. My honor. Let's go to Jennifer in Tampa. Good morning, Jennifer.
Hi there. Thank you for your time. I'm just getting out of the emergency room with my husband, and he at dinner Friday passed out, and then came to, passed out again. We ended up calling 911. He was really nauseous, getting sick. They did all the cardio, neuro. We got cleared for all of that, and their final conclusion was that he was low with his potassium and his electrolytes. So they gave him IVs for potassium. They got him hydrated. And so we're just wondering, moving forward, in the Florida heat, low potassium, low electrolytes, next steps. They also mentioned that his valsartan for his blood pressure may be too high of a dose, because his blood pressure without the valsartan all weekend was just maintaining. It was like a normal blood pressure. And they thought that the valsartan might be depleting his potassium and electrolytes.
That's interesting, because losartan actually increases potassium.
Oh.
Yeah, it's very weird. If he had low potassium, losartan's adverse consequence is high potassium. So there's a problem with their rationale. Maybe we need another doctor to look at this problem.
Huh. And they also said, that's interesting. And then they also said something about seeing perhaps a kidney specialist, because the kidney is what regulates the blood pressure. I think they said. And that the kidney doctor might be able to provide some insights on regulating blood pressure without the use of medicine.
Well, that's an interesting thought, because there's this weird thinking in medicine that, if you have a diagnosis like hypertension, high blood pressure, that it's an essential part of your reality and you're going to have it forever. But that's not necessarily the case. And is it possible that your husband has changed his lifestyle and his diet anytime in the last 6 months such that he may not need blood pressure medicine to control his bad habits anymore?
Yeah, he walks. He's hitting over 10,000, sometimes 20,000 steps a day, being mindful of his diet. But I think the walking and losing weight is playing a factor for sure.
It sounds like he's corrected his lifestyle disease, and he no longer needs a medication to treat his lifestyle.
Okay. And then, so we'll just talk to the primary, I guess, for the next steps of decreasing that and then coming off of that, because isn't it something that you don't just come right off of? It could be dangerous. Well,
if the blood pressure is hovering at 100/60, I often stop my clients' blood pressure medicines if they're not on an elephant-sized dose. And many of my patients are on really low doses because they just needed an edge to get them through while they're healing. But so I would talk to a primary, maybe find a good, he's already making progress. So it sounds to me like he may need less medication. So yeah, talk to the primary. If they don't get you the answers you need, find a functional medicine doctor.
Okay, awesome. And any other ideas in regards to potassium, monitoring that, making sure we don't get to that critical low point again?
Well, he's probably not taking in enough potassium, but it's odd that he's on a potassium-sparing medication and he has low potassium. So that would be the realm of the kidney doctor, I agree, because that's a weird thing if that's really actually happening.
Okay. Sounds good. Thank you so much.
You're very welcome.
Okay, bye.
All right, I do have Liel waiting on the line patiently in Lutz, but we're down to the last 20 minutes, and I want to give everybody an opportunity to participate in the Healthy Steps radio show today on WMNF. And just give us a call at 813-239-9663, and you can ask your question. Let's go to Liel. Good morning to you. Hello?
Hello, Liel.
Hi, it's Lilo.
Oh, Leela, hi.
Hi, I have 2 issues I wanted to ask about. Is there any relief for ear ringing, like ringing in the ear?
Depends on what caused it. And so if you had a loud noise injury and you have it after that, it often never goes away. But if you have toxicity, you can actually clear out the toxicity and the ringing will get less.
Yeah, I'm not sure because I've had it for a long time. And
how old are you?
I'm 53. I had to think about that.
Yeah, so it could be a persistent problem. If it's in both ears, it probably is high frequency nerve noise injury. But
yeah, the only thing I can think of is I worked at a pizza place and I was standing by the oven for a year. So I don't know.
Did it happen right after that?
I don't remember because it's just in the background.
Yeah. So have you seen an ear doctor about this?
No.
That would be the first thing. Get a hearing evaluation to see if you do have high frequency hearing loss. If you do, that's the cause. And then that would be something that's unfortunately not treatable. And meditation might be something good to keep you calm when dealing with that noise.
Right. Because I end up, staying up at night because if I don't, the only way to distract from it is to think about something else or talk or whatever.
Yes. So get a hearing doctor to evaluate you for hearing loss and see if that's the cause. Otherwise, it could be something else that's maybe treatable.
Okay, thank you. And my second issue is dry skin, dry scalp.
Yes. Do you eat fish?
I eat fish, not a lot, but...
Do you take fish oil?
No.
So
I'm kind of weird about taking
omega-3 fatty
pills
acid
and stuff.
omega-3 fatty acid deficiency is a really common cause of dry scalp and dry skin.
So like fish oil.
Yes, like a tablespoon of cod liver oil a day would probably not be a bad idea.
And
It's got some vitamin D in it as well. Usually the cod liver has some vitamin D, so that'll help with preventing melanoma.
And what about biotin or the B7? Does that help or anything?
Never used it for dry skin.
Yeah, I mean, and also because like after I was, pregnant, I had a little bit of hair loss in the back, and not like noticeable. I've always had really thick hair, and of course, when brushing, I would, lose a little bit of hair, but now it's more, a lot more hair.
Yeah, so it sounds like you do have some metabolic imbalances there. You might want to get your thyroid looked at, your iodine levels. Protein intake is directly related to hair growth. And so, there's a bunch of things there you could evaluate.
Okay.
But I would get on some fish oil right away.
Yeah. Okay, I'd definitely do the fish oil. All right, thank you.
You're welcome.
And thank you there. Let's go to, I've got Nancy in St. Petersburg. Good morning, Nancy.
Hi. A friend of mine, her doctor told her to stop eating bananas because her potassium was too high.
Yes.
And that didn't sound very good to me, but why would the potassium be high?
Well, that's a good question. It could be for a lot of different things. And my guess is if she's in a doctor's office, he gave her a pill that actually made her toxic with potassium. And instead of changing the pill, he said, take bananas out of your diet. But he neglected to mention celery, white potatoes, cantaloupe, honeydew, and all these other things that contain potassium. Right. So, if maybe she was eating 3 bananas a day, that would be a reason to cut back on it. But I think the first thing is...
intake increase your potassium?
Salt intake does not increase potassium.
It doesn't affect it?
No. Potassium intake does.
Okay. So it's a medication probably that's increasing the potassium.
Quite possibly. That's usually what I see the culprit in my practice is a medication that is like losartan, the blood pressure medicine that is called a potassium-sparing kind of medication. It holds on to it.
Oh, okay. Thank you.
Yes.
Thank you there, Nancy. And I do have Tammy in Clearwater waiting, but we've also got about 15 more minutes. So I'm going to invite you to participate in the Healthy Steps radio show with Dr. Fred Harvey here on WMNF Tampa, and give us a call at 813-239-9663, like that person who's making the lights flash now is doing. You can also send your emails to dj@wmnf.org. Good morning, Tammy.
Hello.
Hi, Tammy.
Hi, thank you very much for all of your information. It's so informative. I just wanted to say that right off the bat.
Thanks, glad to help.
Yeah, great. So I'm calling in regards to my son. He's going to be 26, and he wants to have I'll probably mess up the name, the surgery, pectus excavatum.
Yes.
Okay, and so my concern is we couldn't find very many doctors that do this for adults. He did finally find a doctor that he wants to plan the surgery this fall at the Mayo Clinic in Jacksonville. And he's going to go next month for an ECG stress test and a pulmonary function, but just kind of wanted to get, as being a mother, just very nervous about this. And what's your thoughts on that?
Well, it is a big surgery. We're doing chest surgery. I don't think it's terribly complex, but I don't know. I've never had anybody go for it as an adult. I have really no idea what the specific risk for this surgery is. When I think of invasive procedures, I think of risk versus benefit. So is there a clinical benefit? Is it a psychological benefit? And if there's benefit, then we can weigh that against any risk for the surgery and decide if it's worth it. It sounds like your son feels it's worth it. And I don't know how big his deformity is. For those of you who are listening, pectus excavatum means the breastbone is sunken in. And it deforms the front of the chest so that it looks like there's a pit there. And is your son's very deep, ma'am?
Yes, they said like five like millimeters deep, and he does have like pressure on his chest and sometimes difficulty breathing, and so. Mm-hmm.
Yeah. Hopefully this will relieve it. I don't know. I that's something to talk with the surgeon who does this about. But it sounds not unreasonable if he's having symptoms from the deformity.
Mm-hmm. Okay. All right. Well, again, I appreciate all of your excellent information. I really enjoy your show, and have a great week, Doctor.
Thank you. You as well. And best wishes for your son on that surgery. I think they have some excellent surgeons there at the Mayo.
Great. Thank you so much. Bye-bye.
You're welcome.
And thank you. And we've got somebody from the city of brotherly love. I've got Michelle from Philadelphia on the line. Good morning, Michelle.
Yes, hi. Good morning, Dr. Harvey. I do have a home in Florida, but yes, I'm in Philly right now, but I listen to you often when I'm in Florida, but I'm streaming it today. So I recently have had, in the past year and a half, 2 kidney stones and ER visits. And since my last one 2 weeks ago, I've been reading about what to take and the oxalates. And, I just wondered what advice you can give me to start now.
So they are oxalate stones?
I don't know. I don't know the composition of the stones.
So did they actually catch one to test?
No, they haven't been tested.
All right. So since
go ahead, I'm sorry.
Have you had anybody do a stone risk or a litho-link urine test?
No, I do have a urologist appointment coming up in a few weeks, but I haven't seen one yet.
So when you were in the emergency room, they didn't give you a test to do either, correct?
No.
Do you have a primary care doctor?
Yes, I do, but you can't get in to see them.
Call up the office if they won't see you and ask them to order a stone risk or a litho link. Stone risk is obviously stone risk, and litho link is LITHOLINK. Both of those are urine mineral and pH analyses that help us understand what your stone risk is and help us modify that. If you have, oxalate or uric acid stones, you might want to treat high uric acid or eliminate oxalate foods from your diet, like black tea and okra and starfruit. But when it still comes down to it, you have these stones forming, and then you may need something to alter your urine metabolism by decreasing the amount of calcium that's being excreted. There are diuretics like thiazide diuretics help to retain calcium, so you don't make calcium stones, and changing the pH with something like potassium citrate will also change that. So your urologist and a primary care doctor need the information from the litho-link test to figure out what's next for you.
Yes, okay. And then the supplements and the diet changes will come later, I imagine, is what you're suggesting.
Yeah, but you could eliminate right now oxalates from your diet. Just like really look at those foods. Go online, find a low oxalate diet. University of Pittsburgh's Kidney Center has a really good one. There's a bunch of different ones online. But low oxalate diet is going to reduce your burden. Stop drinking black tea if you drink it.
No, I drink black coffee.
And drink lots of water. Get at least 3 liters a day to flush the system.
And lemon. I drink a lot of lemon water.
And that will put the citrate in there that will help to redirect the pH of your urine to reduce the amount of stones.
Oh, okay, Doc. Does that mean I have kidney disease or?
Well, you'll get kidney disease if you have repeated stones and crystal formation, but right now your collection system is forming stones because of inappropriate mix of chemicals.
Yes. Okay. And I do have like a GI issue that, malabsorbs, I imagine. So it's
they go together, yes.
Yes, a subtle balance. Okay, Doc. Well, I hope to see you personally in a few months when I get back to Florida. That
would be wonderful.
Is reconstructed again. Okay, thank you so much. Enjoy you all.
Have a great day.
Bye.
Good luck with that.
Always seems to be a squeeze play when people call on in the last couple of minutes of the show. I've got Michael, Daniel, and Jack in the queue. So let's go to Michael in Spring Hill. Good morning to you, Michael.
Good morning. How are you?
Excellent. Michael, how are you?
Oh, just fine. Thanks, Doc. I'm a 74-year-old male. I was diagnosed with polycythemia about 25 years ago, and I've got a
Were you on Hydrea?
Well, I was on Hydrea and Agrolide, but they make a new drug called Jakafi, which is it actually cures the disease. The bone marrow is actually working the way it's supposed to now.
Oh, good.
So my levels have been perfect. My platelet levels and my red and white cells have been great. My kidney function has gone down the tubes a little bit, but it's been pretty steady. So I've got a nephrologist, and back in 2015, Dr. Norman removed one of my parathyroid glands to help with the calcium level. So we're doing pretty good, but I'm having issues. I actually have a consultation with Dr. Norman again because my calcium's really, although it diminished quite a bit, it's come back, and I'm up about 11.5, and we're testing kidney function, obviously, and my EFGR is I'm still in the mid-30s, which isn't bad because I've been steady there for about 5 or 6 years.
Uh-huh.
But I just can't seem to control my potassium. I was listening to one of your calls a few minutes back. My potassium fluctuates. I get monthly blood work, blood draws. I do CBCs and CMPs every month.
Sure.
And my potassium has been fluctuating. It'll go up, like just recently. Last month it was 5.7. It's usually about 4.6.
Are you consistent with your potassium food intake?
Yeah, I don't do any bananas. No French fries, no citrus fruit. I try to watch.
No celery, no cantaloupe.
No celery, no cantaloupe. I try to use head lettuce instead of the romaine and the leaf.
Yeah, it sounds like you're trying to avoid it pretty well. So, you've got some delicate kidneys there.
Yeah, I've got some pretty good sized cysts, but I just had an ultrasound, and they found some complex. One of my cysts was complex, but then we did an MRI with and without contrast, and everything's fine there. Prostate isn't doing too bad. I got a whole team of doctors working for me.
So what do you need from me?
I always wanted to ask you if you had any other suggestions for the potassium, because I actually just got back from a doctor's visit.
Well, the issue here is that it's really a complex situation, and I don't know enough about you to make any potassium recommendations. You have a team of doctors that are working on that delicate issue, and exactly. Potassium levels are so critical for arrhythmia and everything that I can't make a recommendation. I can just say, listen to what your doctors are telling you because you got some complex issues.
Okay. Yeah, I feel great. I'm real active. I get retired now, 10 years, but I get outside and work outside usually 3 or 4 hours every day.
Keep going, man.
Right before the nap. I do an afternoon nap every day.
I'm really glad you mentioned that new medication. I didn't know about it. The Jakafi it hits the actual genetic mutation that occurs that causes your problem. So that's really cool.
Yeah.
Medical science keeps moving forward. I love it.
That's crazy. Well, thank you very much.
You too. Have a great day.
Have a great day. Okay, bye-bye.
All right. Let's go to Jack in Lutz. Good morning, Jack.
Hi. Thanks for taking my call. And I'll try and make it quick because I know you're bunched for time. I developed some, I guess what I call them insect bites in the crook of my knee, on the backside of my knee.
Yes.
And I tried treating that with, I went to a dermatologist because they were not really resolving. In fact, they were kind of itching. And he suggested trimecolone. I don't think I pronounced that correctly. What is concerning me now is...
What was he treating with that?
The bites.
Okay. He called it bites?
Yeah, he said it looks like insect bites, and I could understand why. I think I was sitting in a Adirondack chair. That would be a good point of contact.
Sure.
The problem that I'm having at this point is that now, 10 days later, I am getting more eruptions in the same area.
Sounds to me like you have a problem with an infection, either bacterial or viral. It could be like shingles, but it could also be staph or strep.
Okay. What would the recommended antibiotic be?
Visit a doctor and get it reevaluated.
Very good. All right. Appreciate your help. Thank you.
You're so welcome. Have a great day.
Thanks.
And Bill, I think I'm going to just move on to emails as I'm down to the last minute.
Yeah, you did get a fistful. Go ahead there, Doctor.
So here's one from Bill. He asked, can chelation therapy lower blood pressure? Yes, actually, there is evidence that intravenous chelation therapy does lower blood pressure. And one of the reasons I would recommend chelation therapy, well, the primary one is to detoxify toxic metals, lead, mercury, arsenic, get those kind of things out of the body. And then there's also oral chelation with a wide variety of things, including plants. Plants actually chelate some of the bad stuff out of your body. Chlorophyll is a great chelator, so eat greens. But I would actually, if you're having a high blood pressure issue, I would get it evaluated because it could be toxic metals. Could be a lot of other things. Let's see. Here's one. I have a dark spot on my chest, had acne since my early 20s. I believe this man is senior citizen at this point. I'm not certain. But my doctor friend said you need to get it looked at because it's the size of a nickel. It was scraped and it was a melanoma. PET scan said it was done to see if it entered lymph nodes, but luckily it only showed in the area on the chest. It easily could have metastasized if it went longer. It's really good that you actually went to see it. The doctor said it had been a few more months. It could be in your lymph nodes. And I agree. It's really good you got there, Peter. I'm so glad you got it taken care of. That is a really important thing. And here's another one about a melanoma. I saw a story about a woman who got a melanoma, and the sign was a vertical brown streak on her thumbnail. Absolutely. Underneath the thumbnail is something that's really strange, and it does occur. There's pictures of it online. Go take a look. It's scary. On that note, I want to tell you thanks for participating today. This was a great show. I really enjoy your engagement. And thank you, Bill, for running the boards. So appreciate working with you. And Irene, thank you for taking all these phone calls and handing all these wonderful people off to Bill and to me. Till next week, for more Ask Me Anything, have a wonderful one and really put those healthy steps in front of you. Take care.
Indeed, and not to be forgotten, thank you very much for a wonderful show there, Dr. Harvey. And as always, thank you, Irene, for making all this possible. And to all of our listeners and callers, we really appreciate it. Stay healthy. You have been listening to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa. Just behind the curtain and patiently awaiting is 5 minutes of NPR News, followed by the Sustainable Living Show, hosted by the premier duo of Annie Ellis and Tanya Vidovic. Until next Monday at 10 a.m., thank you for supporting and listening to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa, your community-conscious radio station. Stay safe, stay thoughtful, and know that you are loved.